This short video is on the rehabilitation of chronic low back pain. We will aim to keep this video as short as possible, but without compromising on vital information. If you're watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type.
Okay, so chronic low back pain is referring to pain in the lower back area. It's not referring to pain that comes from a specific injury, such as an injury to the disc, fracture of one of the spinal bones, or an underlying disease process. It's more of a musculoskeletal origin.
And what actual structures are we dealing with now when we're dealing with a kind of common chronic low back pain?
So lots of structures can be implicated in non-specific mechanical low back pain. We're typically thinking of muscles, of some of the little joints that run up and down either side of the spine.
Is that what they call the facet joints? Yeah.
So each level has a respective one left and right, and again going up and down each segment. So we've mentioned muscles, we've mentioned these joints. There are also ligaments that run between the different vertebrae, and along with connective tissues, which carry a lot of nociceptors or nerve endings that are sensitive to pain.
Okay, that's actually quite useful to understand what areas are affected, but what events, what lifestyle factors can lead to the development of chronic low back pain?
So low back pain is extremely common. It can be sometimes hard to single out a specific singular cause. We do know that spending a long time in sitting postures, especially sitting in chairs that are not so ergonomic, can increase the risk of developing low back pain. Taking on too much activity too quickly before you've kind of acclimated to that load, picking things up with poor technique. Often we do see people bending over and twisting at the same time, maybe picking up an object they didn't quite realize was as heavy as it is, as well as trauma. So falling over, those can all be caused triggers for back pain.
I suppose the job of people like you as an osteopath is to also screen out what other conditions might be mimicking a mechanical low back pain, but maybe coming from other structures like the internal wall.
Absolutely. I mean, low back pain is extremely common in sort of 90 to 95% of cases. It is of sort of non-specific mechanical origin, but it is important to rule out any underlying pathologies.
So you need to consult someone. Fantastic. Now, we have a model here that is going to demonstrate some of these exercises, and I'd like you to guide us through some of the easier stuff that you prescribed at the beginning of a rehab program, and then how you progress through this particular program.
Absolutely. So the next exercises we're about to demonstrate are very common, very simple, very safe, and very effective. So to begin with, Matthew, if you'd like to join me down here on the mat. The first exercise is going to be a simple knee hug. So we're going to start with just doing one leg at a time. So if you're comfortable lying flat on your back, go ahead. Now, if it's uncomfortable getting down into this position the way Matthew demonstrated, you can get onto your side and just lower yourself down in a nice controlled fashion. In order to do this exercise, what I want you to do, Matthew, is to take your right leg and with your arms just gently grasp around your knee and gently pull it towards your chest. So the goal here is not to be going into pain. It might feel a little bit uncomfortable to begin with, and that's okay. But anything that's sort of exceeding a 4, 5 out of 10 on that pain rating scale is what we want to stay away from doing. We can now swap over and do the same thing with our left leg. What I'd like to show here is a modification. If you do have any knee pain, instead of grasping around the shin where you have Matthew, if you just grasp on your thigh behind your leg there, that's another way we can bring that back and alleviate any potential pressure on the knee joint.
Are there any rules and regulations as to how long you should hold it and how far you should take it, Spiros?
So addressing the latter question first, in terms of range, we are going within what we are able to do. So if Matthew was to take it further and it begins hurting, then we want to ease off a little bit. As I may have mentioned, a little bit of discomfort is okay. We do have some pain going on and we are trying to improve our range. But it shouldn't be painful. You shouldn't feel worse afterwards for having done it. In terms of duration, what we're really going for is, this would typically take between 30 and 60 seconds. We're not really trying to focus too much on time. So in this position, if you feel like you're just staying still, you could just gently bring your leg backwards and sort of gently pulse that movement for me. Good. What we're trying to do here is, again, increase that available range of motion. We're trying to decompress that lower back and encourage a little bit more movement, and to reassure the kind of nervous system that this is safe and the muscles don't need to be on red alert, ready to seize up.
What would be the next logical part after this?
Once you're feeling comfortable doing this, we can proceed into doing both legs at the same time. So what I'd like you to do is hold onto both legs for me. Again, that modification of holding behind the knee is perfectly fine if you have issues with your knees. And in this position, again, you can just gently pulse a little bit back and forth. Again, the goal here is just to get a little bit of movement into that lower back area and through the hips. From here, we can start introducing some other vectors of movement. So we can start adding a little bit of rotation. So this is like a very regressed windshield wiper type movement for the core. We're going to actually keep our feet on the ground to begin with, and we're going to let our knees go out to the right and then go back the other way. As before, we're trying to stick within a range that is comfortable and safe for us. We're not going to be pushing into a position where it feels like our muscles are on the verge of locking up and causing us.
If you have an elderly patient that cannot lie on the floor, could they do this on the bed? Is that acceptable?
Absolutely, you can do that on the bed. Of course, the firmness of your mattress is going to dictate how much you sort of dip in. There's nothing wrong with that. It's just if your back is quite sensitive, you might find that softer surfaces may be better or may be worse. So it's going to be a little bit of trial and error.
Thank you. What would you want to do next after this?
So in order to progress this side-to-side mobility exercise, we can proceed into a little bit more of a stretch. So in order to do this, what I'm going to have you demonstrating is with your left leg, Matthew. If you let this leg go straight for me, and you're just going to reach this leg over that way. Good. And we're just going to reach our arm up sort of over our shoulder. What we're doing here is having a nice sort of rotational movement through our low back. We don't have gravity acting straight down through us, through our spine, so it's quite a safe position to do this from. Again, the same thing I've been saying every step of the way applies here. We're not going into pain. We should be feeling a stretch. Focus on taking some nice deep breaths in and exhaling and just feeling those tissues slowly ease a little bit. So the next thing we've got going on is introducing a little bit of a stretch to our hamstrings. So if our hamstrings are tight and they're coming up and attaching into our pelvis, that can be putting undue strain on our low back when we try bending forwards. So in order to counteract that, we are going to just do some simple hamstring stretches. I like to use a belt or a towel or some kind of strap. In this case, we have a resistance band. Matthew, what I'm going to ask you to do is just loop part of the resistance band around your foot and then hold either end in your hands. Excellent. What we're doing here is just bringing our leg up towards 90 degrees. Now, don't worry too much about the range of motion you have, and don't worry too much if you have a very slight bend in the knee, that's okay. What we want to be feeling is a stretch throughout the hamstring muscle, and again, you might feel a little bit of discomfort in the low back. That's fine. The key word here is discomfort, not pain.
Absolutely.
In this position, Matthew can experiment by just bending his knee a little bit and seeing if that gets him a little bit more range, seeing how that affects the discomfort that he may or may not have in his back, and then gradually just trying to extend the leg in this position. So kind of pulsing in and out of having a straight leg and a slightly bent leg.
So that stretches the hamstrings, a bit of the glutes, and even the calves as well, isn't it?
Yeah.
So you're
and what people sometimes find is by trying to keep their leg completely straight, that the tension, the combined tension from the hamstrings, the calves, as well as the sort of sciatic nerve as it runs behind the knee, causes a lot of discomfort and doesn't really allow them to stretch the actual hamstring muscle as much as they might wish. So this is called a sort of figure 4 stretch. It's a great way of stretching your glutes in a lying down position. What I'd like you to do, Matthew, is cross one leg over your other knee. Excellent. And then just reach through and hold on to the back of your thigh. And you're just gently pulling that knee towards your chest. What you should be feeling in this position is a stretch on the opposite side to where you're holding on. In that position, again, take it as far as is comfortable, not eliciting pain, but feeling a nice deep stretch. What I'd like you to do, Matthew, is to get up onto your hands and knees. And again, we're supporting our low back, so we're not putting load through. Our hands are in contact with the ground. What I want you to do, Matthew, if you just take a little shuffle forwards for me slightly, excellent. I'd like you to just sit back onto your heels and let your hands slowly slide out forwards in front of you. You can just walk them out a little bit if the floor is grippy. If it's more comfortable for you, you can let your knees open up slightly. Good. And what we're focusing on here is just sitting back into our heels. So we should feel a nice stretch through our lumbar spine. Some people might feel a little bit of stretch in the back of their hips. And we're going to basically start performing a bridge, essentially. So in order to do this, we're just going to bend both of our knees so our feet are flat on the mat. And we're going to be focusing on driving our hips up towards the ceiling. Now, this can be done in a number of ways. There's a way we can kind of roll up segment by segment, or we can kind of keep ourselves as a continuous sort of unit, if you will, from shoulders to hips and just drive up that way. Really squeezing those gluteal muscles and then coming back down. Mm-hmm. So maybe about a second's hold at the top. Okay. And then you can become a little bit more dynamic. And when this feels quite easy, you can progress onto doing a one-leg bridge. So you would make sure you feel nice and supported, and then pick a leg you want to start on, so in this case the left leg, and we're trying to keep our hips nice and level as once again we just drive them up towards the ceiling and bring them back down. Excellent. So we can do sort of anywhere between 10 to 12 repetitions of this before switching to our other leg, or if you prefer you can alternate your legs, so you can do 1 rep on your right leg, 1 rep on your left leg. So this next exercise, before we progress on to trying to introduce a bit more extension, which is the opposite of bending forwards, is called the cat-cow. To do this, what I'm going to have you doing, Matthew, is just letting your belly button drop down towards the mat. You can look straight ahead of you, and then we're going to go the opposite way. Excellent. And then we're going to repeat that. You might find that as you let your belly button drop down, that you can take a nice deep breath in. And then as you bring your belly button back up towards the ceiling, you can exhale. So the next thing I'd like to do is progress into what we call a cobra press up. So what I'll have you do here, Matthew, is just let yourself kind of come straight down towards the mat, so you're more lying on your stomach. And then just gently, using your arms, lift your shoulders back and up to a point that is comfortable for you, feeling a nice extension in that lower back area. Too much, or you're finding that it's hard to hold yourself up on your hands, you can just prop yourself up on your elbows. So if I could just get you to go onto your forearms, Matthew. Good. This position you might find is a little bit less demanding and fatiguing on the arms. So moving on with another strengthening exercise. This is going to get the gluteal muscles, the hamstring muscles, and our lower back paraspinal muscles. I'm just going to have you lay on the floor, Matthew, with your kind of head on your hands. And what you're going to do is just gradually try and lift your shoulders and arms and everything off of the mat. Good. So we're engaging our lower back muscles. If this is starting to feel perfectly manageable and easy, and you want to progress yourself a little bit further, you can now start trying to lift your legs up at the same time. So when we start engaging the legs, what we're doing is getting the gluteal muscles to engage, a little bit of the hamstring muscles, everything that extends the hip, working in tandem with the lower back, as it should. So now, in order to try and get that cross pattern of firing going that we'd like to see, what I want you to do, Matthew, is just lift your left leg and your right arm up off the mat. Good. Takes a little bit of thinking. And repeat the opposite with the other side. Fantastic. And continue. Good. If you can just bring your right leg back towards the wall. Good. And bring that back down. So when you do this, do that again for me, please. And do that again with your left leg. What I want you to pay attention to is imagining that someone has just placed a bowl or a glass on top of your back and you're trying to keep it as steady as you possibly can. If you're finding that you're getting a lot of pressure underneath your knees when you do this exercise, you can double up the yoga mat in which you're doing it on, or you can place a cushion underneath your knees. We're going to let our right leg come back towards the wall, and we're going to bring our left arm straight out in front of us. The next exercise I'd like you to do is being called a dead bug. So I'm going to have you go onto your back once again, Matthew. Now, I want you to imagine you're in that crawling position, except you're on your back, hence the term dead bug. And what you're going to do is just to begin with, let this leg come straight out towards the wall and bring it back up. Do the same thing on the opposite side. Again, we want to have our core as engaged as possible to reduce any kind of rotation and rocking that we might have at the hips. Once you feel comfortable doing this, what I want you to do is bring your opposing arm back towards the wall behind you, and bring the leg down. And alternate for me. Excellent. If this feels quite challenging, we can let our knees come down to the mat, so we're reducing the load slightly. And if we want to make it harder still, then we can start making it slightly off, slightly asymmetrical. So we can lift one of our arms up slightly or one of our legs up slightly, just shifting the force ever so slightly like this. We can then move on to side planks. So if you could go onto your side, prop up on that elbow, and again, if we need to make this easier, we can just let our knees bend and come down to the mat slightly. So we're essentially deloading slightly. Good. So in this position, you can elevate that one leg. So you're having to get the right leg, in this case, lateral hip muscle.
But are there any other things that they could do in terms of improving their rehabilitation program in addition to the exercise and lifestyle advice that you would give?
Absolutely. So as we touched on a little bit at the beginning, we were talking about things that can cause back pain in the first place, such as sitting down for prolonged periods of time, maybe desks that are not very ergonomically set up, or by sort of training too much without adequate recovery in between training. So advice I'd often give people is to make sure that if they are desk-based, that they're sat at an appropriate height with their feet kind of resting on the ground and not dangling or not kind of...
And as we've seen since the pandemic, a lot of people are working from home, and they're using inappropriate chairs, inappropriate desks.
Absolutely. And you don't need to spend a fortune to just improve the setup. You can simply just raise your laptop up on a few books, get a very inexpensive keyboard off of Amazon, so you're not having to hunch down as we typically find ourselves doing, especially as we stop thinking about our back and start thinking about our work. The other thing is having regular movement breaks. So even if your desk is the most ergonomic thing in the world, if you spend entire 8 hours
get up,
sat down, it's not going to be doing you any favors. So get up, move around a little bit. Some phones and wearable tech has reminders to get you to stand up every hour or so. If it doesn't, just enable one on your phone, just set a reminder.
That's a good way. Otherwise, people get engrossed in their work, and then next thing you know, several hours later, they're still in that position.
And with respect to people who are quite active and are training a lot, exercise is fantastic. We just want to make sure we're allowing time for recovery in between our sessions, and making sure we're stretching muscles that we're working. So we're not just strengthening, but we're also maintaining the range of motion that we want.
And if there isn't satisfactory recovery taking place, you would offer additional advice, I suppose, with...
So back pain can be... it doesn't necessarily resolve in a very linear fashion. It's normal to have a few little ups and downs, but typically once you do start making some of the right changes, such as moving more, allowing adequate recovery between sort of gym sessions, if you're a gym goer, and you've been introducing these stretches and exercises, you're not really noticing any tangible benefits within sort of a week to 10 days, then I would be thinking about getting it assessed to explore a little bit further. And depending on what the clinical assessment identifies, potentially exploring diagnostic imaging or
get further referral, X-rays or MRIs or whatever is appropriate. And what's your opinion on taking things internally, tablets, analgesics, anti-inflammatories, antispasmodics, things like that? So
right back let's say the most acute stage of that low back pain, any of these exercises might be too uncomfortable and too painful. In that instance, rest is fine. Resting for anywhere between sort of 12 to 48, maybe 72 hours at a push is necessary. But beyond that, we actually want to get ourselves moving. Because if we just stay in bed and feel okay, well, when we get out of bed, we might not feel so okay. So we want to get moving early. If pain is quite bad, then taking some analgesics, such as paracetamol, ibuprofen, either orally or applying certain gels onto the area, is a very valid method of controlling symptoms. Just do check with your pharmacist.
Absolutely, double check that. And finally, there is a lot of debate about hot and cold applications. What's your opinion, or are you divided as well?
I think it comes down to two things. Symptom management. If you find that something is alleviating the pain and that's your number one priority before you're then able to start getting up and moving around, then that's fine. Use of heat on something that is acutely inflamed might make it actually feel a little bit worse, whereas use of ice on something that is a little bit inflamed might be slowing down that healing process, because inflammation is that kind of first aspect of a healing process. But we're now kind of talking about chronic low back pain, not acute back pain. So contrast bathing, so hot to cold, all of that stuff is just is absolutely fine and safe to experiment with and see what works for you.
And if you're not getting better, go and see your specialist again, your physical rehabilitation specialist.
Yeah, it's always great to get an assessment just for that peace of mind, to make sure there isn't something that's masquerading as simple low back pain. That could actually be something of a more concerning origin.
Thank you. That was very useful. Thank you. And thank you, Matthew. Causes of low back pain: sprain or damage to the muscles, ligaments, tendon, discs, facets, and neurological structures, and of course some others. This may be caused by long-term wear and tear, the types of activities, injuries, immobility, inflammatory conditions, operations or surgical, and psycho-emotional factors.